Okay, I want to share my experience with you guys.
Put your ear down. Put your ear down.
Something happened today. A man walked into the pharmacy, not a young guy, an average guy, like should be in his late 40s or early 50s. So he came to get a cough syrup. So I stood up to attend to him. You know, he he explained what he came for. He wanted a medication for dry cough. He has been having this unproductive cough for weeks now, and he needs something to take care of it. So as a pharmacist, I didn't rush into bringing cough syrup, antibiotic, antihistamine, and all of that. So I engaged him into a series of questioning. So at first, it was like I'm stressing him. I should just get down to getting him a medication that will take care of his cough. He was actually in a haste, according to him. So all he wanted was just give me the medication and let me go. So in the course of our interaction, he was actually taking a BP drug. So he's hypertensive and taking a BP drug. So I asked him if he can remember the particular BP drug he is on. Yeah, he brought out amlodipine and lisinopril. I just smiled. I said, okay. So I had to pause and educate him.
Clap for Jesus.
And I told him the cause of his dry cough and what he needed to do. And I thought of bringing it here for you guys because I know it's not just him. There are so many persons, either you or someone you know, that is taking a medication that is causing another problem. And the only way to solve that problem is stop the actual cause of the problem. So I thought to share this with you guys, how your BP drug can lead to unproductive cough. But before I do that, I want to give an overview of what blood pressure is. Maybe I will talk about that in details in my other videos, but today it will be focused on how your BP medication, especially the ACE, don't worry, I will explain,
Unlike from me, I hear what TV they talk.
is responsible for that unproductive cough. Okay, so now in simple terms, blood pressure is simply equal to cardiac output and peripheral resistance. So in BP management, whatever that can reduce the cardiac output, by the way, cardiac output is the heart rate times stroke volume. You understand? So whatever that can reduce the cardiac output can reduce your blood pressure. And there are so many medication that works in that line. And whatever that reduces your peripheral resistance, total peripheral resistance, can also reduce your blood pressure. So most of the BP drug we have is either working on the total peripheral resistance or working on the cardiac output. You understand? So this particular set of drug I mentioned earlier, the lisinopril, that is CEI. Okay, so it stands for angiotensin converting enzyme inhibitor, that is the ACEI, and we have few drugs under this class. Okay, example of them is lisinopril. We have enalapril, captopril, and all the pre, you understand? So they belong to this class of drug. And what is their mechanism of action? I know medical students will benefit from this most. You understand? Now, they, like, just like the name suggests, angiotensin converting enzyme inhibitor. So they inhibit an enzyme called angiotensin converting enzyme. That is the name of the enzyme. Now, what does this enzyme do? This enzyme converts angiotensin 1 to angiotensin 2. And angiotensin 2 is the bad guy. So it's a potent vasoconstrictor. You understand? And from what I said earlier, if the vessels are constricted, it can lead to high blood pressure. So whatever that will reduce the constriction of the blood vessel can reduce your blood pressure. So are you seeing the relationship between this ACEI and blood pressure management? So they inhibit this enzyme ACE, that is one of the enzyme, ACE angiotensin converting enzyme. So they inhibit this enzyme from converting angiotensin 1 into angiotensin 2, thereby relaxing the blood vessels and decreasing the blood pressure. But there is one thing with drug, and that is why I always advocate that you know your medication and take it right. In as much as this drug, lisinopril, captopril, enalapril I mentioned, is inhibiting this enzyme from converting angiotensin 1 to angiotensin 2. You understand? They are also inhibiting the breakdown of bradykinin and substance P. You get? So this bradykinin and substance P are being broken down by this same enzyme. But now this enzyme has been bundled up, has been tied and kept in a dark room by lisinopril, enalapril, and captopril. That means we now have an accumulation of bradykinin and substance P in the airways. And if I can take you back, substance P is an excitatory neurotransmitter, right? And bradykinin is a chemical mediator. So what happened is the accumulation of this bradykinin and substance P will send a signal to the brain. And once that happens, the brain will interpret it and will send a cough reflex. So you begin to cough unproductively. That means the cough, you're not coughing out anything. So that was what this man was experiencing while taking lisinopril. But he walked into the pharmacy asking for cough syrup and antibiotic to take care of that. Let's assume I wasn't a pharmacist. Let's assume I wasn't informed. Maybe I would have given him something different. So, but locking him, he met me and I told him to stop lisinopril and to do something else. And if you're interested in what I asked him to do, put it in the comment section and I will tell you what I asked him to do or what I replaced it with. There is no two ways about it. I asked him to stop. Yes, he has to stop. Because actually not everybody experience this side effect of lisinopril. Some persons take it and they are fine, but 7 out of 10 from what I have seen and the research experiences such side effects, and the only way is to stop it and substitute it with something else, a different class of drug. And if you're interested in that class of drug, you can come to my comment section and take care of that. So guys, that is it. So whenever you walk into a pharmacy and the pharmacist decide to ask you questions, please give him the needed answer, because in the end, it's just for your own good. Okay, so let's assume this guy finally did not open up. How would I have known the drugs that is actually killing him slowly? So remember, my mission here is to help you understand your medication and to take it right. So in my next video, I will take time to explain the management, holistic management of blood pressure, how to manage your blood pressure and the right drugs to take. I know we have some persons who are medically inclined will be like, yes, replace it with ARB, that is angiotensin receptor blocker, but which of the ARB are you replacing it with? And so guys, don't just gain this knowledge alone. Like I've always said, make sure you share it with your loved ones. Like, comment, and if there is any clarification, if you don't agree with me, please put it in the comment section. Call my attention to it. If there is any disagreement, put it in the comment section and we will resolve it professionally. You understand? Or you need clarification, just put it in the comment section. You understand? So take care of yourself and see you in my next video.